welcome to SVG-TV News for Friday, October 2nd, 2020. I am Rochelle Batiste with the details. The Ministry of Health, Wellness and the Environment today, Friday, October 2nd, 2020, has confirmed the 6th dengue-related death. The victim is a 30-year-old female who had a pre-existing condition and was admitted to the intensive care unit of the Milton Cato Memorial Hospital in a critical condition. She died on Thursday evening, October 1st, 2020. In a news release yesterday, the ministry said that as of Tuesday, September 29th, there were 514 laboratory confirmed cases of dengue fever recorded in SVG, and that the hospital services program as well as the community health services program continue to report increased patients presented with symptoms consistent with dengue fever. It says measures to manage this surge in demand for care have been implemented, and these include provisions of increased nurses, doctors and beds. The ministry is reminding persons with symptoms of dengue fever of the vital importance of seeking health care in a timely manner to avoid the possible complications of delayed care. Patients are also urged to comply with the recommendations of their healthcare providers, especially for testing, treatment, review, and admission where necessary. The symptoms of severe dengue fever include severe abdominal pain, dizziness, bleeding, and vomiting, and can occur after the high fever has settled, typically around the 4th day of the illness. Dehydration is caused by the high fever, vomiting, and decreased drinking of fluids. Dehydration results in decreased urine or tears when crying in a child. The ministry says this is dangerous and must be aggressively treated. Persons with pre-existing conditions such as kidney disease, sickle cell disease, and reduced immunity are at increased risk of developing severe dengue fever. Home treatments for dengue should focus on reducing the fever by using cool and not cold baths, the use of paracetamol, not ibuprofen, as well as using papaya leaf extract and maintaining hydration by drinking lots of fluids such as coconut water. The public is also reminded to use insect repellents, bed nets, and cloths that protect as much of the body as possible from mosquito bites. Further, that all must work together to reduce the number of mosquitoes in the environment by eliminating their breeding sites, as the fight against dengue fever is a shared responsibility. And the government's pharmaceutical services has given the go-ahead for papaya extract to be used to treat dengue fever. This was decided based on evidence that the plant extract from the leaves have proven to be an effective supporting treatment for patients affected by the mosquito-borne disease. Larissa Pugsley-Kidd tells us more in this report.
Places the affected person in a better position to ward off the virus, to recover, and to reduce the illness period, to reduce hospitalization, and it also reduces mortality as well.
That was Chief Pharmacist Levi Walker of the Government Pharmaceutical Services within the Ministry of Health, Wellness and the Environment, speaking on the use of the papaya leaves to treat dengue fever. The decision to advise the ministry on the use of the papaya leaf was taken following a meeting of pharmacists, medical and nursing professionals. Walker explained that the mature papaya leaves have been used in other countries and in SVG, and it has been tried and found to be effective. However, there are guidelines how to administer the papaya leaf extract. Walker said that there are 2 formulations recommended for extraction. One is a cold press or blending, the other is to simmer or boil as recommended.
So we have about 50 grams of leaves, 50 mils of water, and you can add to that about 25 grams of sugar. And that is blended or macerated, and it forms a pulp. You then squeeze the juice from the pulp, and it can be stored in the refrigerator for about 24 hours. The second formula is where you take 3 to 5 mature leaves again, cut them in small pieces. You can place them in a saucepan with about 2 liters of water, allow it to simmer or to boil. You leave it open. At some point, when the volume of the liquid is reduced to 1 liter or half of the amount you started with, then you will cover the saucepan.
As regards the dosage, Walker said it will vary from adults and children.
For adults, you can take up to 30 mils, which is about 2 tablespoonfuls, and that could be used 2 to 3 times per day, preferably before having your meals. For children, they can use 5 to 10 mils, which is 1 to 2 teaspoonfuls, 2 or 3 times per day, preferably again before eating. And this mixture should be taken for about 5 days or until your symptoms improved. We are encouraging persons who will want to use this preparation to begin using it as early as possible. If possible, maybe the first day that you have symptoms.
Walker said there are no observed or documented side effects using this treatment, and it has been concluded that it is safe to use the papaya extract, which can be used with the prescribed medications such as paracetamol.
I have not seen or read any adverse effects or any contraindications or, where a papaya leaf cannot be used with the present treatment that we have for dengue. So in short, yes, if you're taking paracetamol or oral rehydration fluids, then so far we have seen that papaya leaf will not cause any interaction with those medicines.
Dengue, a vector-borne disease, can become fatal if the blood platelet count drops to a minimum low. Platelets are responsible for the clotting of blood. One patient who recovered recalled that her platelets had dropped to 17 and it was only a matter of time before doctors performed blood transfusion. She said, however, though, that after taking the papaya leaves extract, her platelets increased to climb to more than 300.
There's a home remedy. I drank the Papa Bush the Sunday, a glass of just the Papa Bush, blend it and drink the water. I drank that. The Monday I went back to the doctor and I did the CBC as well as my liver, and my CBC was up to 300, which might mean that my platelets gone up to 308.
The medical authorities are reminding that the papaya leaves extract does not prevent dengue. It only works to treat the illness. For SVGTV News, Larissa Pogsley-Kidd.
At a news conference this afternoon, Minister of Health, Wellness and the Environment, Luke Brown, outlined a 3-pronged integrated vector control program to deal with the dengue outbreak. The minister said the plan, which will run up to January 2021, was approved yesterday by Cabinet and will cost just over 1.6 million EC dollars. The bulk of the funds, amounting to just under $1 million, will be used to obtain additional fogging machines and other equipment, which will help to expand the fogging operations island-wide.
Now, you might want to get a sense of what would this money be spent on. It will be spent on, for instance, the procurement of additional fogging machines and related supplies. It will be spent as well to bring into our possession, on whatever terms available, be it rental or otherwise, a sufficient number of appropriate vehicles which could be deployed into the field. It would also be used for us to take on board in a phased way an additional group of temporary spraymen, and it will also address some other costs associated with this project, including the cost of having a mounted truck fogger. Right now we use handheld fogging machines which are mounted or used on pickups and which are able to be deployed into the field through persons on foot. But we're also looking at investing in some mounted truck foggers for this part of the project.
At present, there are 4 fogging machines in use. The plan will also see funds being spent in the area of risk communication and health promotion.
Because we want this message to sink in far and wide. It's important for everybody to do their part to bring this outbreak under control. The ministry will certainly do its part, but in addition to asking what the ministry and what all the various facets of the ministry will do, it's good to ask, what can I do? You know, how can I help? What is my role and responsibility in response to this outbreak? How am I going to be there for my nation or even simply for my household? You know, you don't have to think about it in grand and glorious terms. How am I going to be there for my household and my community as we deal with this? And I don't have any doubt whatsoever that we are going to deal with it and that we're going to deal with it decisively and deal with it well, because it is in our nature. And
another component of the response plan will be to clear and clean rivers and drainage systems in identified areas.
And this naturally has to be ongoing work. But the work is happening, and we're going to do it in a systematic way in the upcoming period at sites that will be identified by the environmental health officers and with persons who make themselves available for the execution of this work. You know, one of the things which has been heartening is the way in which we see many volunteer groups and associations come forward and say, and put their hands up and say, I want to see what I could do to help. You know, and we're going to do this work for the cleaning and clearance and so on with volunteer organizations and with persons who are specially recruited for this purpose through the Public Health Department, and they will carry out activities throughout our country. And, you know, we will be guided by the science. We will take an evidence-based approach. We know the districts which have been disproportionately affected for whatever reason, and we have to get to the bottom of that.
Minister Brown has come under heavy opposition criticism for his handling of the dengue outbreak. In other news, some 28 children between the age group 3 to 5 years from Bayabu and surrounding communities will continue their preschool education in a new learning environment. On Thursday, the Bayabu Early Childhood Development Center was opened. The modern facility has accommodation for 2 classrooms, each having the capacity to cater for 25 to 40 children. A principal's office, a sick bay, a modern bathroom facilities, a storeroom, and indoor and outplay grounds. The project was funded by the Caribbean Development Bank, the CDB, and the government of St. Vincent and the Grenadines at a cost of 1.2 million EC dollars, with the Basic Needs Trust Fund as the implementing agency. Speaking at yesterday's opening ceremony, Minister of Education Sinclair Jimmy Prince said education is of paramount importance to any civilization, and the government since 2001 has set about to uplift and revolutionize the education sector in the country. He said the opening of the Bayabu Early Childhood Development Center is part of the government's trust to deepen the education revolution, giving 3 to 5 year olds a boost to self-development.
Historically, early childhood care and development here has been left to private providers, NGOs, the church, community groups, etc. The revolution changed all of that. And the government made a deliberate decision to enter the subsector, recognizing that appropriate early childhood education can minimize disparities among children as they enter the formal education system. We recognize also that the early years are critical, and the quality intervention at this time is absolutely important and can make a great difference in the outcome of these children.
Minister Prince said as part of efforts to further improve early childhood education, the government has introduced statutory regulations and standards, including licensing of centers throughout the country, and that they are in the process of having regulations and standards become law in accordance with the Education Act. He noted that the Bible Early Childhood Development Center is the 13th such center constructed and opened since 2009, with one in Richland Park and at Connery soon to be opened. Prince said the focus is on providing quality pre-primary education to all children, especially those in rural areas and those at risk.
It should be noted that the establishment of these centers moves the subsector towards the provision of quality service. The target all students, including the physically challenged. This particular center and the one at Richland Park are equipped to cater for children with special needs. This is in keeping with our watchwords in education of equity, access, and quality. Spread throughout the country are approximately 115 or so privately owned centers. And government has invested in some of these operations in helping to upgrade them. I know you wouldn't think that there are so many we have in the country, 115. Currently, we offer a subvention, and 86 of these centers receive a monthly subvention of $400 from government, as well as a feeding program service to centers with enrollment of between 12 and 15 students or more. And we offer also continuous training to teachers to improve the quality of the teaching and learning in this particular area.
The Education Minister said the government's commitment to early childhood development is quite strong, as is their commitment to general educational development in SVG.
The education revolution is on a roll, and every subsector has been touched, whether it be primary, secondary, post-secondary, tertiary, in TVET, in special education, in adult and continuing education, in every area, in every subsector of the education system in this country, government has ensured that there is improvement.
Member of Parliament for South Windward, Frederick Stevenson, described the opening of the Bible Early Childhood Development Center as a proud moment and said he is happy to be the one to deliver the facility to provide further educational opportunities for children in Bible and surrounding communities.
It has been a challenge and a difficulty, but every challenge and every difficulty can be overcome with persistence. I outlined to the Ministry of Education what I wanted for an early childhood center in Bible, and I persistently reminded them that this is what I want for the community of Bible. After having been elected in 2010, one of the things I campaigned on, a promise, was that once elected, I would remove the preschool from down there, down at Lodge, and have it fitted somewhere in the Bible Methodist School yard. And today, after 10 years, we now have this brand new edifice in the yard of the Bible Methodist School.
Stevenson said the impact of early childhood education to learning development is one which the government has been seeking to advance.
No matter where you come from, as long as you're persistent and dedicated towards your own personal development, there is always an opportunity for you, and the government will continue to provide the necessary funding to assist our young people to achieve to their highest goals in life.
The Unity Labour Party, the ULP, is the party of choice for the 2020 general elections. So says party leader, Prime Minister Dr. Ralph Gonsalves during his address at the party's third virtual meeting on Wednesday evening. PM Gonsalves says soon the electorate will be asked to make a choice between the ULP and the New Democratic Party, the NDP, and the choice should be clear as the ULP is the natural party of governance.
The ULP has consistently articulated a coherent vision, philosophy, policies and programs fit for our country and the challenging times which we face. Our vision is undoubtedly people-centered. Our philosophy is that of social democracy applied to the circumstances of St. Vincent and the Grenadines. Its philosophical premises are evident through the uplifting and majestic language of the preamble to our nation's constitution, framed under Labour's watch in 1979, and the delivery of good governance. Our applied philosophy and historical understanding prompt our further idea of the ennoblement, the further ennoblement of our Caribbean civilization and its magnificent Vincentian component. Our economic approach raises aloft an efficacious, harmonious partnership between the private, cooperative and state sectors.
PM Gonsalves said, unlike the NDP, the ULP has a comprehensive development narrative which it has implemented despite the multiple external challenges.
On the other hand, the NDP does not have any coherent vision, philosophy, policies, and programs. What you get from the NDP is a number of disjointed ideas and proposals, and everyone who purportedly speaks for the NDP has his or her own set of half-baked ideas or ill-conceived plans. The result is a veritable Tower of Babel, tacking always to opportunism and embracing right-wing, conservative, wrong-headed ideas and anti-people prejudices and instincts. They demonstrate what they are really. Nothing but a coalition of anti-Ralph and anti-ULP personages, determined in their opposition objectively to genuine progress and looking very much like yesterday's men and women with day before yesterday's ideas.
Educational institutions across St. Vincent and the Grenadines today were presented with the Vincentian Patriotic and Folk Songs publication at the Peace Memorial Hall. The handover kicks off independence activities organized by the Ministry of Culture, Youth and Sports. The National Cultural Foundation played an integral role in crafting the publication, and according to its chairman, Wallace Christopher, the idea is to preserve this aspect of SVG's culture for future generations.
In doing this, we are helping to preserve the work of many of our great composers, people like Alban Henry, Ebenezer Duncan, people like Pat Prescott, many of whom have passed on, and a lot of us don't know much about these persons and their work. So this book is helping to create awareness as to the work that they would have performed.
Junior Sutherland, who was the driving force behind the project, said that once persons have the book in their possession, they can access the songs using a QR code, which is an additional feature of the book.
All you have to do now is focus your camera on the QR code and the link will pop up. You click on the link, it takes you to the Google Drive, and in that Google Drive now you will meet 3 folders: an addenda, patriotic songs, and school songs. Now the addenda is, we would have made 2 corrections in the publication. The grammar school song would have changed 1 word, and then the publishers would have forgotten to put in the 2nd page of St. Vincent, My Homeland by Yvonne Francis Gibson. So we saw it fitting to put in these two scores as the addenda, in that addenda edition. Also, if you don't have a smart device, it's no problem. You can also access the songs by typing in the short URL that is also accompanied on the card.
The third phase of the project will be the recording of the songs live by the RSVG Police Force Band.
Put inside of the Google Drive, so then you schools can access these. So then now you will have the recorded studio version, you will also have a live performance of the police band, so you can use your school songs at all of your various school official functions, also at your sporting functions. We will also be advocating for these performances by the police band, these recordings be played at inter-school. When you have your medal presentations, that these songs can be played for the winners.
Marion House today celebrated 31 years of existence with a special church service at the Roman Catholic Cathedral in Kingston. Director Jeannie Oliver said that thousands of youths have benefited from the programs offered by the institution over the 31 years since its establishment. A release from Marion House stated that those who have benefited include 2,000 youths, 650 parents, 300 substance abusers, 10,000 clients at base and about 500 at outreach communities. This year, the organization plans to add sustainable programs for the unemployed vulnerable youths between the age of 15 to 25 years whose parents live below the poverty line. Programs for the LGBTQ are also being looked at. Further, this year, the organization is hoping to source additional funding for its youth on the leeward end of the mainland due to a high interest of a number of them from that area. Reports of criminal activities for the past week, September 24th to the 30th, have fallen by 7.7%. This information was provided by Inspector Henry Providence during the Police Care Facebook program last evening. Inspector Providence said there was a total of 60 reports, which include theft and wounding. Noting that wounding offences accounted for 33% of the total reports, Inspector Providence provided some pointers how persons can deal with situations which could result in wounding-related offences.
One must always try and settle all arguments amicably. Secondly, surround yourself with positive-minded people. Avoid trouble spots or trouble areas. Report any suspicious activities you might witness. And we have to also remember that we cannot do this without you, so that is why it is very important that when you see any suspicious activities that you report it to the police. Do not take matters into your own hands. And lastly, do not participate or practice vigilante justice.
With respect to theft, which accounted for 41% of reported cases for the past week, Inspector Providence also shared some suggestions how to prevent fallen victims of such crime. He noted that the members of the RSVG police force and the public must be applauded for their efforts to keep the country's crime situation under control.
Be aware of your surroundings. It's always very important that you are aware as to what is happening around you. Pay attention to people that you are around. Be careful when using electronic devices in public. So do not take things for granted. Be discreet where it relates to what you own. All right? Do not make yourself a target. And lastly, as much as it's light in you, avoid traveling alone.